Hi everyone, I am Pham Giang, a master's student in international health at Universitas of Gajah Mada. Today I would like to present my study. The title is Assessing the Acceptability of the Health Education Program in Dengue Prevention and Control in Buon Ma Thuot City in Dak Lak Province, Vietnam. Dengue fever is a serious human herpesviral infection that globally spread and is top concern among healthcare professionals and government, including Vietnam. The best method to prevent and control dengue is vector control, which is supported by social mobilization and health education. The objective of our study is to assess the acceptability of health education program in dengue fever prevention and control among health staff and community in Dak Lak Province, Vietnam. This study was implementation research with a qualitative method. The study area is Dak Lak Province, an endemic area of dengue in Vietnam. We conducted 9 in-depth interviews and 6 focus group discussions at province, district, and ward level. And here are our results and discussion. There were 6 out of 7 components coded in on transcript, namely effective attitude, perceived effectiveness, intervention coherence, ethicality, and self-efficacy. Meanwhile, there is no transcript mentioned about the opportunity cost. In general, the group of health staff, health collaborators, and teachers who are responsible for the health education at school and households had positive feeling and appreciated the effectiveness of the health education program. This could be explained by the fact that the health staff and collaborator teachers have been communicated to the community and peoples over years, so that they have built good relationship with these communication receivers. Therefore, the health staff, collaborator, and teacher could easily approach the community and peoples and ensure the delivery of the health education program. Murphy and Gardner 2019 also indicated that the pre-existing relationship between the health program deliverer and receiver could influence the overall impression and willingness to participate the program deliverer. A health staff from Center of Disease of Control also said that about the communication. In general, the communication in dengue prevention has been for a long time and done many times and raises the public awareness. If we come to ask the public now about dengue fever, they could know very well. Besides, limited budget was considered a major burden by all delivering groups. This concern about limited budget for health programs had been mentioned in many research. The community was considered to have very good awareness of dengue after receiving the health education communication. This improved awareness is similar to the result of other knowledge, attitude, and practice assessment. However, the practice remained limited. The maintenance of the preventive practice requires longer time and support from the health staff. To conclude, the acceptability of health education program was considered to be positive, and the transformation from education to behavior would take time and require the persistence of the education program. Lastly, the theoretical framework of acceptability was useful to evaluate the health staff and community perception about the program acceptability. That is my presentation. Thank you so much for your attention.